Hello, I am Dr. Naveen Mehrotra. I am the Chief Neurosurgeon at the KIMS Sunshine Hospital. We treat conditions related to the brain and spine. Spine problems are very common and which we encounter almost in our day-to-day lives. Sometimes when we get the back pain, we commonly call it as a sciatica and we start getting some treatment for it. But of late, we have seen that when we investigated these patients with MRI, and we hear that the patient has got a spinal tumor. And once we hear this word of spinal tumor, there is lot of shock or fear in our lives. So I will be sharing our experiences with what types of spinal tumors are there and what is the treatment for these spinal tumors are there. So the spine you see is made up of two things. One is called as the bony spine, that is the bone, and then there is a spinal cord, which is the nerve which is contained within the spine. So the tumors can arise from any of these structures. So the spinal cord, which is the main nervous structure, which is the continuation of the central nervous system, and that is the nerve which controls all our body movements. So it is covered by a membrane which is called as dura mater. So the tumor can arise outside this as well as inside this. So if it is outside this, it is called as extradural, and once if it is inside that membrane, it is called as intradural. And once it is inside the spinal cord, then it is called as intramedullary tumors. The symptoms vary from each location of this tumor. So normally, if we have a back pain and that is becoming worse over a period of time, and this pain is becoming more during the nights, or if it spreads along one of the hands or legs in young patient, then probably this is one of the things is that you might be harboring a spinal tumor. If this tumor is associated with weakness of the limbs, like it starts from one side on the left hand, left leg, left hand, and then the right hand and right leg, probably that means that the spinal cord or nerve is getting compressed because of this tumor. And in the late stages, because of this spinal tumor, we may get problems in passing urine on motion also, and that is the sphincter dysfunction, and which we usually encounter very late during the course of the illness. So apart from that, then the third comes then how to diagnose this patients with spine tumor. So the investigation of choice remains an MRI, that is magnetic resonance imaging, along with contrast is the investigation of choice to find out whether the patient is having a spinal tumor or not. Then what types of spinal tumor we have? The majority of the spinal tumors which we have are benign. Almost 2/3 of the tumors which we have in the spine are benign tumors. Very few of them they appear or they have a malignancy. One of the malignancy which we have in the spine is that the tumor is secondary or metastatic, meaning by that we have a tumor elsewhere in the body and that has spread into the spine. If it is, that is usually not good. Surgery remains the mainstay for treatment of the patient with spinal tumors. So surgery means if it is an extradural tumor, we remove the tumor, and fixation is the thing. If it involves the vertebra, then removal of the vertebra or the affected vertebra, for that we may require fixation. Otherwise, fixation is usually not required for the patient with extradural tumors. Secondly, it is an intradural tumor. We open the dura, we remove the tumor, that is called as intradural excision of the tumor. And thirdly, if it is an intramedullary tumor, meaning thereby the tumor is within the spinal cord, then the surgery becomes a bit tricky, and we do this surgery under intraoperative monitoring, in which we monitor and so that we remove the tumor without causing any damage or adding on to the weakness of which the patients have. So once we have operated the tumor, since majority of the tumors, spinal tumors are benign, usually the outcome is good, and the post-operative we ask the patients to take rest for a few weeks and they can go back to their normal life. If the patient has got malignancy, then after the post-operative removal of the tumor, we ask the patients to take radiation. If the patient has got the spread of metastatic disease, then the treatment of the primary disease along with that is required for these patients. Usually the outcome of the patient with spinal tumors are good, and they are usually able to go back to their normal life. Thank you.